with our presentation today. We're going to talk, this is careviso, and we are going to talk a little bit about our company as well as some of our product lines, and we're going to have some special guests talking about how they use our services from Penn Medicine, discuss how careviso has helped their genetic testing components. All right, my name is Shauna Hay, and I am the VP of Clinical Operations, and I have been with careviso since 2021, and so I've been in this space for quite a while, as well as 12 years experience within the prior authorization space. I'll talk a little bit about what careviso does and how we can integrate with your work for genetic counseling and to get prior authorizations, and then we will listen to a institution that uses careviso and uses our services to help their patients, and then we will also describe some other product offerings that we can help you all with to get prior authorization and transparency for your patients. So what do? We basically help this sort of in this patient care space. There is so much that is new and changing in prior authorization in healthcare and health insurance. And so what we do is we allow physicians and genetic counselors to focus on the patients rather than the paperwork. As you know, it takes a lot of effort in order to go in and figure out for health insurance your patient has, what the prior authorization needs are, how to do that, whether it's through a portal that you have to register with or a fax or even a phone call these days. And so we take that away from you so that you can just focus on the patient care and not have to worry about that prior authorization process and all that red tape and paperwork that goes along with it. Just some stats on careviso. We have a platform, as I said, and we help provide access to care faster by delivering the cost estimate and then all the administrative requirements and the approvals that can possibly happen in real time. We take care of that follow-up for medical review. We take care of all of that sort of paperwork and the administrative burden that prior authorization causes. We have done 1 million prior auths performed annually, and we have a very high successful approval rating because we do all the extra steps and we make sure we gather all the materials so that you don't have to focus on whether or not you need the clinical notes for that patient or the special signature or the special form. We know all that. Every day we work to determine the best route for different health insurers. I know there's big health insurers out there and we do prior authorizations for those, but we also do that long tail of all the smaller plans, all the state plans and everything else. And we are the knowledgeable folks. We are the subject matter experts in this prior authorization process. So for us, if you send a patient to us, regardless of what health insurance, we can figure it out for you and determine how to get that prior auth through the system. We also have lots of laboratory partners and over 200,000 enrolled physicians, which is very important to us because we do have some plans that require the physicians to be a part of the prior auth process. So this is our process flow. As I said, we contract with laboratories, so the laboratories will contract with us, and we also get a BAA or a business agreement with a physician, healthcare provider, genetic counselor in order to perform a prior auth process on behalf of the physician. So doc, genetic counselor orders the test, sees the patient in the clinic, and sends it off. And they don't have to worry anymore because they've sent it off and they don't have to worry about that prior auth requirement because the lab's going to receive the order. And then payer allows lab to perform the prior auth or payer requires MD to perform prior auth. Either way, we can do it for you. So the laboratory is going to send us all this information and it comes across various different ways that we get it. And usually within a day or so, we start working on this case and we figure out what the appropriate path is. They're all different. Every day there's something new that happens. It's amazing to me. I've been in this business for so long, and every day I'm learning something new about a new way to do a prior auth or a payer changes their methods of prior auth. So we figure that out and we stay on top of it. We perform the prior auth, whether it's through a payer portal, a fax, a call, or any other route that we have to do. And then hopefully the prior auth is approved. We get all that information, we do all the follow-up, and then the lab can run the test and get paid. And then you as the physician or the genetic counselor can get the results and then act with your patient to figure out what's the next best treatment method. Physician-directed plans are unique, and this is where we have to get sort of those business associate agreements with the medical provider, the genetic counselor, or an institution. There are plans out there that require a physician to do the prior authorization. And with these agreements in place, we can perform on behalf of the physician. These are some big plans that require this. United Healthcare is one of them. There are a lot of Blues plans that are also sort of the same. The list changes, so I don't want to have them listed out here, but we keep an eye on that. We know which ones require enrollment. We know which ones that we have to have those agreements with, and we will actively seek those out when we receive samples and cases from those patients that require to go through a physician-directed plan. And then institution and hospital enrollment best practices. Originally, when careviso was started, they really wanted to have the business model where they were using the best practices. We were not going to go out and do prior authorizations on those physician-directed plans on behalf of a provider that we've never had a contract with. That's just not a best practice. And so we use a third-party solution, or what is considered also a hub services model. It's been advised by attorneys. It's what the OIG opinions state that we need to have done. And basically, we enroll institutions and we make sure that we have a BAA between careviso and the institution, as well as an MSA. And there's no restriction to a physician from ordering from any lab. Once we have this enrollment in place, if we get a case in from LabCorp, we could do that one. If we get a case in from Quest, we can do that one. It just doesn't matter. It just allows us to perform on behalf of that provider. So we're not going to limit a provider once they assign these agreements with us to a specific lab. We also have the same agreements in place with our laboratory partners so that we can also provide services on behalf of them. We don't want to step on any toes. Everything is very documented and very clean and neat so that we follow all the best practices. And then SOC 2, type 2 is a data security. It's an environment where we protect all the customers' data. We have lots of different IT sort of certifications, but this is one of the highest ones that you can receive for data security. And also all of our staff do annual HIPAA training, annual security training. We make sure that everything is HIPAA compliant and we're not sending out information inappropriately. And so I'm going to toss this over to Jacqueline and Danielle, and they're going to talk a little bit about how Penn Medicine and their experience with using careviso has helped their practice.
Thank you, Shauna. Excuse me. Hi, everybody. So by way of introduction, so my name is Jacqueline Powers. I've worked as a certified licensed genetic counselor since 2008, predominantly at the Hospital of the University of Pennsylvania, and then in more recent years transitioned to the role of Associate Director of Genetic Counseling for Penn Medicine's Cancer Service line. So doing a lot of access and equity to genetic testing across our growing network.
And hello, my name is Danielle McKenna. I have been a clinical cancer genetic counselor at Penn Medicine since 2014, and I very recently transitioned to a new role at Penn where I'm working to increase efficiency of genetic testing across multiple specialties at Penn.
And then next slide. So just a little bit of background about Penn Medicine. So we are a large academic medical center. And our main hospital is centrally located in Philadelphia, Pennsylvania. Go Eagles. We are a dedicated NCI designated cancer system or a center, and we're embedded within a health system. So we have a lot of specialties and subspecialties across our network. Penn Medicine is kind of a conglomerate of hospitals as well as ambulatory clinics. And so we have regional representation as far out as central Pennsylvania, so Lancaster General or Lancaster County, all the way to New Jersey, up to Princeton, essentially. The cohort that we'll speak specifically about today is really based in adult oncology. And so in terms of our patient volume, we see about 4,000 patients per year via what we would call a traditional new patient genetic counseling pathway or through these consultations. And the majority stem from our downtown location. We are currently hybrid, so we service patients via telehealth as well as in person. And I think a big statistic to note for today's conversation is that we have an estimated 90% now of our pre-authorizations are handled by careviso. So been life-changing. Next slide. And you might have to click a couple buttons, yeah, to get all the way there. But this is just a representation or an illustration of our network and our reach and our growth and our representation. So in total, we have 15 cancer genetic counselors spread across sites. We also have about 4.5 genetic counseling assistants, which we'll weave into the conversation today. So it's just not essentially based in Philadelphia, but careviso has really kind of made our operations more efficient across the system. Next slide.
So to dive in a little bit more into our careviso experience from Penn Medicine, one of the biggest questions that we had is who covers the cost of this service, and it was covered by the labs. The labs are sponsoring the cost of this service, so it was no cost to Penn Medicine. And probably the biggest hurdle that we had to get through was that we had to get our BAA through Penn Medicine's legal team, which is kind of notorious for just slowing things down in general. So that did take a little longer than expected. It took about a year to get through, and it was particularly hung up on how we were going to reach an agreement about the institution feeling comfortable with how it relates to accessing payer portals on behalf of the physician. So that was the big holdup, but we eventually came to a resolution. And then so many things changed for our group in 2020. So obviously COVID-19 hit, which was not a positive thing, but it did change our practice significantly since we transitioned mostly to telehealth. We also integrated through HL7 with a lot of our different genetic testing labs. And so we can actually place genetic testing orders in Epic. So for a lab like Ambry, for example. And then as Jackie alluded to, we also hired genetic counseling assistants. And December 2020 was also when we got careviso approved through our legal team. And so all of these things kind of converged at once, and it really resulted in a significant reduction in administrative work for genetic counseling, but also, related specifically to the pre-verifications that we were running with AIM for Anthem or Beacon for United Healthcare. It really came at a good time because, between 2017 and 2020, I remember all the genetic counselors were starting to feel overwhelmed. Oh, we have to fill this form for Aetna and this form for Cigna, and where do we have to go for United Healthcare? Where do we have to go for AIM? What are the other ones that I'm missing? And so it was just starting to feel really overwhelming. And so that was the perfect time for careviso to kind of hit the scene. So if you want to go to the next slide. They have really become our quarterback. So careviso and the lab, they work in partnership to really reduce a lot of this workload from the genetic counselors. So much so that Jackie and I actually had to be like, wait, who's doing all the work? Because it's not us anymore. And so we were trying to figure out how much of it is falling on the lab, how much of it is falling on careviso, how much of it is falling on our GCA. And it is a combination of all three of those things, but so much so that genetic counselors are doing very, very little in this space anymore. And it's been life-changing, as Jackie mentioned. We feel really lucky, really spoiled now. There does remain, some communication between the lab and your team. So they'll ask for particular documents like clinical notes, pedigrees, etc. Our GCA handles all of those requests, and it doesn't necessarily have to be a GCA. It could be any other administrative staff, because everybody has made it so efficient and streamlined that it doesn't really require a whole lot of, clinical input anymore. So huge decrease in cognitive burden on the providers. They're so organized, and you don't have to worry about what are the specific portals or the specific forms that I need to fill out for this specific patient. They're going to let us know. And, between lab, careviso, and our GCA, people are handling it, and they just let us know when we need signatures. So we've gotten to a really, really good place in this space. Next slide.
Yeah, and I can't emphasize enough, having to update your password and then forgetting what your password is. That was I felt like 25% of my week was what password am I using now? So in terms of communication, so we identified that communication does take place between several key members. But we're really only brought in, the genetics team specifically, when additional supporting documentation is requested, a payer form or a pedigree. And as Danielle's provided, that's really managed by our GCA, but the process is so efficient and streamlined, it could be anybody that is working within your team, administratively speaking. And so we identified some key ingredients. careviso has been incredibly responsible and responsive and collaborative. Our commercial lab account specialist is highly organized and communicative. We have a fantastic relationship with specifically at Ambry, who we liaise with the most. And again, we have, it's a minutia of all of this, but administrative staff to support the extraneous document requests from the lab. But if you have that, it's a really great trifecta that's made this experience so much so that we don't think about it on a day-to-day over the last couple of years and had to relearn what goes on and what's in the sauce to present today. So it's really not much of a mental lift for a genetic counselor at all. Next slide. Yeah, and so this is just to support that since the inception of careviso, that BAA that went into place December 2020, we're averaging, or careviso is averaging about 300 pre-auths per month processed specifically from our team. So just think about how much they're doing on behalf essentially of our team. And also I think the biggest thing is not having to remain privy to what's new and different and changing. Like that, oh, that form's updated, I submitted the wrong one. Oh, this insurance now requires what? So it really takes the headache out of it. So I can't speak highly enough. And I think sometimes you go into these exercises thinking like, what is this going to cost me? But truly it doesn't cost anything to the institution because the lab is sponsoring this on behalf of you. So it's in my eyes, I'm sure Danielle too, really a no-brainer. Just getting that BAA through.
All right, we're gonna take some questions. Thank you, Jacqueline and Danielle. I'm glad we take it for you because I love what I do, and it's actually really fun and surprising every day, figuring out the sort of the navigation of the prior auth pathways. So Rachel, do we have any questions so far?
One question that came in is who was on the for the UPenn side, who was on the legal side to help get the BAA through? Was it the lawyers or compliance or both?
I can find out exactly if compliance was involved or not, but I think it was just through the standard legal team, and then a genetic counselor helped to liaise the process, as well as the careviso representative really helped us as well.
Yeah, I think it was just generally our Office of General Counsel.
Great, thank you. All right, thank you, Danielle and Jacqueline.